Welcome back to the Wall Street Review. Today, we are analyzing Subtle Medical, an artificial intelligence imaging company that recently closed a highly targeted $33 million Series C financing round. Modern hospitals are facing an acute operational crisis. A routine MRI or PET scan takes up to an hour to complete. This specific physical limitation creates massive patient backlogs and places enormous strain on an already stretched workforce of imaging technicians. Hospital administrators are caught in an economic trap. They own reliable, functional imaging scanners, but those older machines are inherently slow. Replacing them with faster, modern hardware requires multi-million-dollar capital expenditures that most facility budgets simply cannot support. That financial tension snapped into focus in June 2026. Subtle Medical secured $33 million in growth capital, a round anchored by Morgan Stanley Expansion Capital. Alongside the cash infusion, the company executed a calculated leadership change. Founder and scientist Dr. Enhao Gong transitioned to Chief Science Officer. To replace him, the board brought in Ohad Arazi, a 20-year executive in commercial healthcare IT, to take over as CEO. This combination of capital and executive realignment moves the company past technological validation. Subtle Medical is now scaling its enterprise footprint with a specific mandate to reach break-even profitability within the next 24 months. Subtle Medical builds a vendor-neutral AI software layer sitting directly between hospital scanners and the central database. When an older scanner captures a sparse, low-quality image, Subtle's algorithms process that raw input, reconstructing it into a sharp, diagnostic-grade image in less than 10 seconds. The clinical performance metrics validate the approach. The company's lead products, Subtle MR and Subtle PET, allow technicians to cut patient scan times by up to 80% while maintaining clear image quality. This effectively rewrites the depreciation schedule of hospital hardware. Facilities can keep their legacy equipment running longer, preventing perfectly good machines from becoming prematurely obsolete. For hospital administrators, the return on investment is immediate. A facility can double its daily patient throughput and the revenue generated by that imaging room without buying a single new machine or hiring additional staff. Subtle Medical has built a software bypass around traditional hardware monopolies. They take the massive capital expenditures normally required for scanner upgrades and convert them into flexible, highly profitable software-as-a-service subscriptions. This business model does face a serious long-term threat. Heavyweight manufacturers like Siemens and GE have the resources to eventually bundle native AI reconstruction software directly into their next-generation scanner firmware. To defend against hardware consolidation, Subtle Medical is expanding its software's role. They are moving into the clinical safety space, relying on deep alliances with global pharmaceutical companies to protect their position in the diagnostic workflow. The first major alliance is with Bracco Imaging, around a product called Aimify. This software applies Subtle's deep learning to contrast-enhanced MRI scans, actively amplifying the visual signal of brain lesions so radiologists can spot them with higher accuracy. They are applying a similar strategy through active clinical trials with Bayer Pharmaceuticals to develop a new technology called Subtle GAD. This split-screen comparison shows exactly why the medical stakes here are so high. Gadolinium-based contrast agents are toxic heavy metals routinely injected into patients to make tissues visible. Subtle GAD uses generative AI to synthesize perfect diagnostic images while reducing the required dose of gadolinium by up to 90%. This creates a highly defensive commercial moat. A hospital administrator might just drop a third-party software tool if their new MRI machine scans fast enough. However, they are highly unlikely to cancel a subscription to a platform that actively protects their patients from heavy metal toxicity. By linking hardware output to pharmaceutical safety, Subtle Medical embeds itself into the clinical standard of care. This move shifts the software's value from a simple speed upgrade to a specific component of patient risk management. Through hardware-neutral software and pharmaceutical alliances, Subtle Medical is positioning itself to compete directly with major imaging manufacturers for control over the diagnostic process. Please note that the information discussed in this video is for educational purposes and does not constitute financial advice. If you found this analysis valuable, hit the like button, subscribe to the channel, and join us next time on the Wall Street Review.